Anyway, thinking back to last October, the second week when I was in Haroldport, there was it's kind of, yeah, I can remember everything. It's just difficult to sort of talk about it, get it all out. Yeah, I didn't. A lot of them, it's respiratory wards. So a lot of the other guys, and it was guys, it wasn't any women. Um, they were all on oxygen, things like that. Fella opposite me, I can't remember his name, but he used to teach computer science, and he was about 80, and he had trouble breathing, so he could talk for a bit, and then he'd suddenly run out of breath, so he'd be sort of putting the mask on his face like that. And the fellow next to him was Bernard. That's right, Bernard. And I talked with him about fishing a lot because he was quite keen on fishing. And yeah, it's kind of a bit strange when you're a bit out of it. And then there's a fellow next to him. What was he? He was into a particular band. I can't remember who it was. Kept going on about. Anyway, he was from. Oh, it's on the River Frome in Somerset. He was from. I can't remember the name of the place, but anyways, his family turned up and everything and saw him. And I can remember all the events that occurred. And who was the guy? Oh, the guy next to me was. It was a bit weird. It started off, he sort of turned up one night and didn't really know where he was. And he sort of wandered into my cubicle, well, my little area, you know, the thing with the curtains drawn around it. And he was an Italian fellow, but he was 80. He used to work in one of the greenhouses in the Nazing Valley. Lee Valley. So anyway, he was. His family turned up, and his wife was quite quiet. His two daughters were. I think one was a speech therapist or something like that. And the other one was very. I don't know. She was very vocal, the speech therapist one, and the other one was very sort of reserved and sort of and yeah, I think they got him a chair in the end, so they you know, one of those, a bit like the beds, you can lower them and make them go up and down and all that stuff. He had a chair, I don't know why, but he kept getting out of bed and falling over and things like that. And there was some other fella. There was a fella up in the Kingsmore ward who had a permanent. Probably not supposed to talk about this. You're not allowed to film when you're in there. You're not allowed to. And he had a what do you call it? A urine bag. You know. He kept getting up to go to the toilet, even though he had this bag. So the nurse kept coming to him and saying, "You don't need to go to the toilet because you've got a bag. You just go." So he just kept doing it anyway. And then there was another fellow. I can't remember all their names, you see, because you're quite wrapped up in yourself when you're there, and you're sort of just observing. You're not really able to do much about anything. This fella up the end who was he was really quite ill. He had a lot of, it was a bit like erythromelalgia, but he had it all over his body, sort of. He had a lot of trouble talking. Yeah, I mean the people there, they're all nice. They're all Pentecostal, member of Pentecostal church and all this stuff. They're all really nice. And I remember it was good. I mean they bring things round. They come round with the food every day. Somebody comes around with food and then the medicine, and then had a bit of a bad relationship with my IV pump thing because the alarm kept going off, and I couldn't bloody work out how to switch it off. So I had a bit of a fight with it one night, and it kept going beep 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 all that for ages. Eventually somebody came in and sort of disabled it for me. I didn't know which buttons, but I don't have the manual for the bloody thing. So it kept going beep beep. Anyway, so yeah, so I think another night I took it off the stand and threw it out the curtains. So probably, But I got quite annoyed with having the IV stand as well, because when you get up and you want to go to the loo, you're sort of attached to it, and you sort of, for God's sake, you have to disconnect it and then go to the loo and then come back. Although sometimes when I reconnected it, it wouldn't start up again. So I ended up taking the bloody thing wheeling it with me to the toilet. But yeah, I remember Carla there. Carla was, she was, I think, the head nurse there. She said apparently on the first week when I was wheeled into Kingsmore after having the E-bus procedure, I was very, I was quite, how did she put it? Not erratic, eccentric, or something, a synonym for eccentric, something like that. Anyway, so she said, yeah, I mean, she was there in the last week and sort of gave me the sort of bag of the medicine and everything like that to wait till the fellow came round with the medicines. But another day, I was in the Harold ward, and I could see everything that was happening, and the diabetes woman came up right to my face like that, right, really close, looked in my eyes, and I must have been unable to talk or move, but I can remember that happening, and I felt pretty rough at that time, I must admit. So, but I wasn't unconscious. I was aware, but she sort of put her face really close to mine, and I can see it outside myself what's happening, but I can, from inside myself, it's kind of weird. So anyway, so that happened. But I wasn't like that all the time. I went to the Marks and Spencers quite a few times and got in trouble the first time, and the Nigerian nurse fella, that I thought had it in for me. Because I kept trying to use the blood pressure machine to measure my blood pressure. Anyway, and he'd tell me off and say, you can't do that. All right. So anyway, he'd follow me down to the, oh well, actually it's on the same level as the Harold Ward, the Marks and Spencers. So you go down the corridor and it's feeling a bit odd, obviously, you know. But I went there and got a sort of, oh no, I didn't, first time I went to Costa Coffee, I think, got a huge bloody great hot chocolate with marshmallows and all the rest of it. And I was, the nurse was following me and I went back with it and I drank it. And of course, my blood sugar went shooting up for the afternoon and I was ticked off for drinking that. But yeah, that was sort of in the end of the second week. I got really, really hungry and started, got a bit dissatisfied with the hospital food and kept going to the Marks and Spencers and buying, I don't know, thing with grapes and salmon in it. It was really expensive. And the sandwiches were really expensive as well. I think usually you would get fish sandwiches. Oh, and I'd get the, what was it, Pink Lady apple juice was really, really nice. So I kept drinking a lot of that. And of course, you know, all those things aren't great for your blood sugar. So, but yeah, it didn't do me any harm. But I've sort of refined my diet now. I sort of know what I should and shouldn't eat. But at the time when you're sort of wandering about in there and you're a bit not quite with it, because I wanted to go for a walk, I just walked. I'd walk out of the ward and just walk to the, I don't know, walk up to the phlebotomy area, and I'd walk back. I'd go round the, sort of go into the radiological area and walk round there. And sometimes they wheeled me down there, because they wheeled me down for an X-ray and an ultrasound one day, I don't know. But yeah, I sort of walked around and yeah, I didn't go everywhere in the hospital, but I did quite a lot of walking around. I didn't go into, I think I did go into the canteen and I sort of decided it wasn't a good idea and it sort of came out and oh God. Anyway, once I was walking around, you could look in the rooms and see all people that had strokes and whatever, and it's quite disturbing. So anyway, yeah, I couldn't think that clearly. It was very jumbled. It was like I'm recalling it now. It's very sort of difficult to make sense of anything, you know, but it was, I just felt like walking. And sometimes I'd go to the loo in the other ward, I can't remember what that one was called, but because that one was broken or whatever, and it was like, sometimes it wasn't always hygienic in those places, you know, but yeah, I managed. I didn't. And there's some people there sort of. Um, yeah, I mean, it, it tended to be older people in their 80s and whatever. Because I'm only 55. Well, I've only just turned 55. But they look after them well. I mean, it's really good. The woman that comes around with the food, and there's a woman that does the cleaning. She was really nice, and they had a strange. Bernard was strange with her, but yeah, it was peculiar. And I think Bernard's wife turned up at one stage. She was ranting and raving about, I don't know, some nonsense or whatever. But can't remember the name of the fella at the end. What was his name? Damn it! Fella who lived Somerset. Do you know what he was doing in Harlow? Oh, that's right. His wife. He was staying with his sister who lived in Harlow. And his sister turned up at one stage. That's right. Just trying to put all the bits together, and yeah, and his family. Oh, that's right. His son was an actor. I think he was I think that was his job. And he was married to a woman. I can't remember. And I think there was two other girls, and he didn't get on with one of his daughters. He said his daughter was always I think she was always right. You get people like that. Yes, he had trouble seeing eye to eye with his daughter, but he loved his daughter, but he just didn't really like the way she was with him. And yeah, the fellow, the computer scientist fellow, his wife was, she was very quiet. She sort of spoke quietly to him, and he kept saying, "Oh, go away, I know what I'm doing," sort of a bit like I'd be. Yeah, he was he couldn't, he was the one that couldn't breathe and had to have the, is it CPAP thing or whatever, over his oxygen. And he had a oxygen cylinder he was wheeling about behind him when he went to the toilet and what have you. I didn't have an oxygen cylinder. I did try the oxygen. I don't really think it did anything, helped. But yeah, it's odd. It's so difficult recalling that that period. Because I'd sort of collected a lot of those the things you wee into, the cardboard things. Collected as many of those as I could, and sometimes I went to the help myself to the food in the food prep area, which I wasn't supposed to do, but I did it. Usually came back with Marmite and jam and I don't know, some bits of toast or whatever. No, bits of bread that I nicked. Yeah, so I had I just had the pyjamas they give you in the hospital when I was there. They give you some socks with rubber on the non-slip socks, slipper socks, which I bought. I've got some at home now, so I don't slip over. But yeah, because it's all smooth floors, and you're walking around on those floors. You want something. You don't want to be walking around in socks. So anyway, yeah, so the fella, there was a lot of doctors that came round and there were students following them, and they didn't look that interested, the students didn't look very interested, supposed to be learning. Anyway, but they're sort of like, anyway, they come round with students and they talk about, this patient, such and such, this patient, whatever. And the big black fellow, I can't remember, he was the head of the Harold ward. He was a very booming voice like that. And a very, very loud voice. And he came and said, can we get this fellow? We need to get this fellow. SPEP and all this stuff. And, make sure we get his bloods every day and everything like this. And that's what they did in the end, but they're kind of just going around on autopilot most of the time. But anyway, so this big black fella comes and he, I think I spoke to him about something. I can't remember really what I said to him. But anyway, they've got all my test results and everything. The Harold Ward, the fella who was, because there was the big black fella who was really, really, I think he was the head of the department or whatever, He was the only one that sort of made any sense to me when he sort of turned up and actually spoke to me properly. Yeah, I can't remember his name anyway, but he was, you could tell he was like in charge because he was, he looked like he knew what he was doing. So, and he sort of had a shorter fellow with him who must have been a deputy or something, I don't know. But, yeah, you're kind of you feel like a bit of an exhibit when you're in the ward like that. You're sort of, you want to go out, but I mean, my lodger turned up a couple of times and went outside and had a cigarette, although I didn't really like it. Out the front. I mean, most of the nurses there are puffing away on bloody cigarettes in the front of the place anyway. yeah, I spoke to a few people when I did that, and then I went back in. My lodger went home, and on the last day I had to wait until they showed up with my diabetes medicine and whatever, all the stuff. It's in my M&S bag, medicines and that. Got this stuff you're supposed to take, you drink it, and it's supposed to stop you getting thrush or whatever. I don't know, I've started to run out of that. The diabetes stuff and the well, I'm not going to take insulin anymore. I don't think it did me any good the other day when I took it, because I hadn't taken it for a long time, and I think the next day I had a few blood pressure increases that may have been due to that. So I'm not going to inject any more insulin. What else have I got here? I've got I've got my corticosteroids, obviously, which I'm taking 10 milligrams each day, and I've got the Omeprazole, which just makes it easier to take those, so it stops your stomach getting. I did have the other day. I had another acid reflux after I'd eaten some tuna in, tinned tuna in rolls, whatever. Had a bit of acid reflux after that. But I've not had that for ages. I used to get it a long time ago, back when I was working at Breathing Buildings. I remember asking Sean Fitzgerald's wife about, she was a gastroenterologist at Addenbrooke's Hospital. Sean is head of Director of Climate Science at Cambridge University now. Anyway, so I remember her asking her about acid reflux, as I used to drink a bit too much at the time, and I used to get a lot of acid reflux. But I've not had that for ages. So I did go to an interview once with KeyMed, who make endoscopes. Although when I went to that interview, it wasn't for the medical side. It was for high-speed cameras. They were developing high-speed cameras running on the Nucleus real-time operating system. I didn't have that particular experience, so I think I didn't get that job. But yeah, that was ages ago. That was probably before I worked at because before I worked at Electrox, 2007, in the December before that, I had got a job with Pillar House International in Chelmsford. That was in 2006, and I'd stopped my citalopram cold turkey that time, and I had severe akathisia a month after I started working with a fellow. He was a nice fellow. He was called Lee. He used to work for ICS Triplex in Malden. He makes safety critical VME bus valve control stuff that, Anyway, so Lee, I was there working at that place, learning Forth, which is a piece of cake. It's not that difficult. And after a week there, I had an attack of akathisia, which was really severe. Had to give the job up, went home and, drank beer and got put back on the tablets, felt better. And that was the first severe attack of akathisia I had. And I don't like to remember those times because I get burning hands when I remember those times. And I think the other times was in May 2009. I think I had tried to taper off it slowly, but using the tablets, no good, you can't do it with the tablets. Over 4 months, and I had the same sort of thing happen, and then I went back on the full dose and I was back to normal again. And then I think April 2014 was difficult. That's when I had I was switched from 30 grams of citalopram to 50 milligrams of sertraline at the end of February, and then in the April I had very bad switch over symptoms. I drank whiskey and, generally was pretty in a rough condition. And I couldn't really work after that. I kept going to the job centre and saying, trying to find work and all that. But I'm pretty sure that if I did go back to work at that time, I wouldn't be able to honour a contract, which is true. I couldn't concentrate, I couldn't focus. I'm better now. I could write code now, but I'd still be very distractible, all the rest of it. I can write code. I've got the assembly language for the Apollo 11, the Apollo guidance computer on my phone. I read through that, it's quite entertaining. Of course, the last fellow I worked for was Dr. Chris Shelton, who was the fellow who invented the NASCOM computers in the 80s. And he's an Imperial College graduate, a bit like my father. My father was an Imperial College graduate. He went, he had Eric Laithwaite as a tutor, and he went to work for Southern Electric, so he worked for them all his life. And the last thing he worked on was the marketing, he's energy marketing manager, and he was selling Economy 7 storage heaters, doing the marketing for those. So anyway, they're all in Australia now. So Dad's got Parkinson's disease, he's in Australia. They've just moved into a house next door to my sister in East West Road in Warragul. And they were over here in this July, and had very itchy skin and wasn't really with it, as you might expect. I don't know why my EGFR wasn't picked up from my 7th of April blood tests, as it was 26.8 then. But back on the 9th of May in 2022, my blood results were perfectly fine, and my EGFR was 104.7. So I had quite a 5-month-long flare-up. It was pretty rough after that. So I think that's the trigger for the sarcoidosis. It's the most logical explanation I can think of. I don't think it's mould or, you know. Anyway, I'll leave it at that, and that's today's video.